Dual tasking occurs when someone has to do two things at the same time. So for instance, when you're walking and talking, we find that it's much harder to do the two things together. As we get older, particularly as we start to lose some of our executive function, we find that when you have to do two things together, when you have to dual task, you tend to fall, misstep, and slip. Therefore, classically in the doctor's office, we have tested people only doing a single task as far as walking is concerned. When we want to know how they're going to perform in the real world, we have to test them doing two tasks at the same time. Mrs. Leach, it's so good to see you today. How are you doing?
Doing okay.
I understand you've been having some trouble with falling and slipping, is that right?
Yes, sir, I have on occasion.
Okay, so what we're going to try and do today is test how your walking is, but in particular we're going to add looking at what happens when we distract you, because most of us as we get older, we tend to fall when we're distracted. If we're paying attention, we do well. So I'm going to ask you to do some tasks.
Oh.
And some of them may be difficult, such as doing a little math. I know you're great with math.
Oh my. I'll try.
I'm sure we'll do very well. So if you don't mind standing up now.
Okay.
In a very short time, by having people do a couple of quick tests, we can find out whether or not their executive function is sufficiently impaired that they no longer can carry out normal walking and balance tasks in the face of having to do something else. Okay, Mrs. Leach, now I'm going to have you take 7 away from 100, 7 away from the remainder, and so on as you walk towards me. So when I say go, you start by taking 7 from 100. So go.
93, 86, 79.
There are a series of tasks that can be used for dual tasking. The first of which is the person is walking, and while they walk, they take 7 away from 100. They then take 7 away from the remainder and continue to do this, saying it aloud. This is equivalent to having a conversation while you walk. What I'm going to ask you to do, Mrs. Leach, is get up from the chair and then walk as quickly as you can towards me. I think that anyone who is getting older where these things happen, we would like to pick them up before they fall, before they have an accident and fracture their hip. The second task, the person will be sitting, they will stand up. This is the classical get up and go, but they will do it holding a glass full of water.
Okay.
So now we're going to do the same thing as we did previously. We're going to ask you to get up and walk towards me when I say go, but without spilling the water.
Okay, I'll try.
You've done so well, so I'm sure this will be good. So when I say go, you get up and walk towards me.
Okay.
Go. And if you notice there, the water is spilling, and there it goes, and she stops. Okay, and that's very good. Thank you. When people fail these tasks, you need to look a little further at what is happening in their life. Are they slipping? Are they falling? Are they at major risk of falling? If they are, if any of these are positive, under those circumstances, you would then put them into a physical therapy program to try and improve their function, both as far as balance is concerned, but particularly in teaching them to walk while performing dual tasks. Okay, Mrs. Leach, now we're going to test your balance, and what I'm going to ask you to do is stand on one leg.
Okay.
The third task we'll look at is just a simple balance task of the person standing on one leg, and then from there being asked to shut their eyes. When they lose their visual input, they often find it difficult to maintain their balance. Shut your eyes if you can while you're up. Shut your eye. Oh, yes, you fell. Okay, we understand when you shut your eyes, people often fall. That's very classical what happens. We find that we pick up people very quickly with this test, and that many of them do extraordinarily well after going through a course of physical therapy for 6 weeks. Well, one last thing we want to do is just try a little bit of dancing. Let's see how well you do at dancing.
Okay.
Well,
Finally, we'll show how you can integrate this very quickly in an office practice by just dancing with the patient.
but you're doing well there. That's really good.
That was very nice, Mrs. Leach. You did very, very well. We've got a few little problems. Every person who's older and comes to see a geriatrician should be tested this way because often people don't recognize they're having problems. But classically, where we would do this is somebody who says they've had a new onset fall, they tend to be slipping, they're having trouble walking. Those are the people classically tested, but certainly anyone over the age of 70 coming for the first time to see a physician or a geriatrician should have some sort of test of their ability to maintain their balance and to carry out dual tasking. So it was really nice to see you today,
Nice
and we're going to
meeting you,
get you better, and when I see you back, you're going to be running around and we'll dance a full waltz.
I love it.